Hello, welcome back to the Leukopak Lady. Thanks so much for joining me today. So far in this season about CSM and the IND, I focused on the donor eligibility, suitability, and qualifications, and why developers need to be intentional about donor testing and donor criteria before ever submitting an IND. Today I want to move on to the collection. I've said throughout this series and in my editorial articles, GMP compliant manufacturing begins with the donor. And that makes the collection of the starting material an upstream processing step, not simply a procurement function. So I want to emphasize today that collection is the first controlled step in the manufacturing value chain. It may seem like semantics, but if the collection is considered part of the manufacturing process, that changes how developers should think about the entire first mile. The main questions developers ask when treating the collection only as procurement are, can we get the material we need when we need it? Can we get enough cells? And can the supplier ship to us? And while these questions are important, they're not enough for an IND supporting cell therapy program. Treating the collection as an upstream processing step forces developers to ask different questions. How was the material collected? What parameters were used? Were those parameters defined for our program and controlled for? What deviations occurred and were they properly documented? Did collection variability contribute to downstream manufacturing variability? Does the collection strategy support the manufacturing process? Is it appropriate for this stage of development? And does it contribute to the overall success of the therapy? This changes the conversation, but the answers to these questions become part of the IND application. In allogeneic cell therapies, the Leukopak is not generic raw material. It comes from a biological donor and is collected through a controlled process, and this process can affect the material entering manufacturing. Collection parameters can influence cell yield and concentration, subpopulation composition, viability, and downstream functional performance. Some of the influential parameters that developers should know about are instrument settings, total blood volume processed, total collection time, anticoagulant, temperature fluctuations, handling conditions, and fresh hold times. So let's break these down. Instrument settings matter because they influence how cells move through the apheresis system, which cells are captured, and how much physical stress the collected cells experience before they reach manufacturing. The total blood volume processed through the apheresis instrument influences the number of cells that are collected, and that volume should be based on the donor's total blood volume, their total white blood cell count, their percentage of target cells, and the number of cells needed for a successful manufacturing run. Total collection time matters because longer procedures may affect the donor experience, influence the number of cells or the overall composition of the final product, and affect the total time cells sit outside the body before being processed. The anticoagulant may affect the donor's ability and willingness to continue the collection, downstream processing and function of the collected cells, and assay interpretation. Temperature fluctuation during and following the collection is one of the top conditions that influence the quality of the collected product. Because these are living cells, temperature swings can disrupt membranes, metabolism, and protein activity, making cells less viable or less functional by the time they reach manufacturing. Handling conditions such as agitation can also affect cellular survival and function. The overall concentration of cells here plays a major role. And fresh hold time is important because if the collected cells sit too long before being processed, cellular recovery can be affected or the cells can undergo death or functional shifts. How well the cells do inside the collected leukopak during the hold is influenced by many factors. Are there too many contaminating red blood cells or granulocytes? Is the cellular concentration too high or too low? Are there temperature fluctuations or unnecessary agitations in the collection, transport, and shipping environments? Whether the material is used fresh or cryopreserved, all of these factors matter and can influence how the cells perform in manufacturing runs and function in the patient. Therefore, the Leukopak needs a defined and supported collection and handling strategy, whether it's on its way to be cryopreserved or on its way to the manufacturing facility directly. A developer should define specifically for their program the collection parameters that produce a product fit for their manufacturing and clinical needs, how long the material can be held before processing must begin, what conditions are acceptable during the hold and transport time, and how everything will be tracked and documented. Developers should keep in mind that every handoff introduces risk. Every delay creates change within the product. Every undocumented variable makes it harder to explain what happened downstream. This is why collection variability becomes manufacturing variability. Tracking variability and deviations from collection to collection and exploring their downstream influence is expected for an IND-ready program. Collections become part of CMC. It affects what goes into the manufacturing process, it affects product quality, and it becomes part of the overall control strategy. Don't overcomplicate collections, but do define everything, document everything, and analyze everything. In the next episode, I'll talk about how to qualify a Leukopak collection site before the IND and what collection data should feed into CMC. See you then.